And welcome to our weekly media briefing and public health update with Montgomery County Executive Mark Elridge. I'm Lorna Virgili, Hispanic Public Information Officer, and joining us today is Dr. Keisha Davis, who is the county's health officer, Dr. Nina Ashford, Chief of Public Health Services, Mr. Sean O'Donnell, Deputy Chief of Public Health Services, Dr. James Bridgers, Director of the Department of Health and Human Services, and our special guest today is Mr. Anthony Featherstone from WorkSource Montgomery. Thank you, everybody, for joining us. Good afternoon, Mr. County Executive. The floor is yours.
Thank you all, and thanks everybody for joining us again this week. Last week, I talked about the sheer scale of our community's connection to the federal government. We've got like 77,550 federal employees in New Call Montgomery County home, and 48,433 federal jobs that are based right here. And that's a massive part of our local economy. It supports families and businesses and also public services that residents depend on. But what's happening now under the Trump administration is starting to shake that foundation. Just last Friday, NIH laid off 1,500 workers. The Department of Health and Human Services is seeing an even broader impact, with an estimated 5,200 probationary employees losing their jobs since the start of the month. And I want to just emphasize on this probationary. I've talked to people who think these are just people starting their work at the beginning of, just coming into an agency. Not everybody is a new employee, new to the field, getting their first jobs here. A lot of these positions are positions that are senior in the agency, people who were doing important work and were being replaced because they retired or they decided to move on. And so not everybody who's not all these probationary employees are just new to the work there. Some are critical in filling critical positions in the research world. It's thousands of people get up every morning, they do this critical work, and now, without warning, they're without an income, and it doesn't stop there. Last week, we received these warn notices. We get them from the State Department of Labor. They come to us when we're notified of a major company leaving that has a significant loss of jobs. So last week, our warn notice was DAI Global, ABT Global, Creative Associates, INT, and Encompass LLC. 808 jobs lost. We received the warn notices, and those are the legal notices companies have to file when they're going to do a mass layoff. And these four companies work closely with USAID in Rockville, Creative Associates Internationals, and Chevy Chase, and Compass LLCs in Silver Spring. And together, like I said, it's 808 jobs. Now, we don't know how many of those individuals are Montgomery County residents yet, but we do know, in fact, if they're in Montgomery County and you lose your job in Montgomery County, then the people who pay your unemployment are the county where your job is. But we do know that the impact doesn't stop at our borders. We have neighboring jurisdictions with federal workers, contractors, and NGOs that are feeling these cuts as well. And many of those workers are Montgomery County residents. So it all adds up. And every one of these layoffs is someone who has got a family, a parent wondering how they're going to pay rent next month, kids are going to still need food, and put clothes on their backs, mortgages and medical bills, car payments. None of that goes away just because the paycheck stops. These layoffs do not just hit families, they hit all of us. Income tax revenue and sales tax revenue, when people have less to spend, are going to suffer, as are local businesses who are going to have fewer customers. Restaurants and dry cleaners and coffee shops and daycare centers, businesses that depend on these workers, are going to feel the squeeze as well. Some already are. This is just the beginning. We could be looking at a loss of tens of thousands of jobs in our region by the time these cuts fully take effect. This seismic shock to Montgomery County and to our region and to Maryland's economy. We are not alone in this. All the jurisdictions around here are looking at the threat of major job loss. We want these workers to know this, at least. Montgomery County has some resources to help. We have job training, resume building, mental health support, and some food assistance. And we'll work with the state to help as much as we can. Hopefully, between the two of us, we can help with a lot of the issues that people are facing. The hardest thing to do, obviously, is going to be replacing people's income. The worst part of all this is the approach being taken by the Trump administration. I can see that finding efficiencies could well lead to some job loss. But this approach is shuttering agencies, dismissing thousands of workers, and dismantling science research has nothing to do with finding efficiencies. It's not like DOGE went into these departments, looked at performance evaluations of employees, looked at the work they were doing, determined that you could do this with maybe a couple fewer employees, so there'd be a better way to organize the department. They did none of that. They just decided they're going to get rid of people. USAID is a perfect example of closing an entire agency without an analysis in the slightest about what they do, how they do it, should it be done. It's just, we don't want to do this anymore. And the approach to government where you're just going to get rid of everything you don't like, despite the fact that most of these things are bipartisan creations from Congress, is particularly disturbing. Firing all probationary workers defined as new employees has nothing to do with looking at the jobs they do and the structure of their agencies in order to determine whether or not there could be improvements that would create efficiencies. And I'll note, I've seen some of the firing notices, and they basically simply say, we're no longer needed, you're not fit for work, and you're not trained for, or don't have the skills where we need them. And apparently the only skill you need is to not work there, because they're not keeping the jobs looking for newly skilled people. They're getting rid of people. The administration has done no analysis of how to do the work better. Their benchmark is that simply they wanted to shut programs down, not to achieve efficiency, but to kill the functions of these agencies. Whether it's probationary employees or long-term employees, the cuts are about stopping government programs. It's about killing government programs. And then you add the element of comparing political contributions to employee lists and targeting employees who are Democrats. This is essentially a political purge, pretty unprecedented in the federal government since the end of the McCarthy era, witch hunts in the 1950s. In my own government, we don't look at an employee's or potential employee's political affiliation. We have to make decisions based on merit in both the hiring and promotions area. Federal decisions being made based on revenge and on a plan to shrink government's responsibility to protect the safety of its citizens and to cripple science and health research that many corporations, like Elon Musk's corporation, feel impedes their ability to maximize profits when research shows that either their processes or their products are injurious to people or to the health of the planet. We should not forget that it was Richard Nixon, not exactly a flaming liberal, who created the EPA because he saw the need for it, not because he was concerned with what tree huggers thought. And so it's kind of dismaying when you're even undoing the work of your Republican predecessors who shared for a long time common core values with Democrats, even if there were differences in degree and differences about how one would spend money. There was a general consensus on the role of government as a protector of the American people. Remind people again that the voting rights bill was unanimously approved by Congress. It was not a partisan bill. It was not a DEI bill or diversity, equity, and inclusion bill. It was a human rights bill. On Friday, my weekly newsletter provided an extensive list of resources that can help in times like these. That list has also been added to our website's homepage in the section labeled Resources for Federal Workers. We've also linked to dedicated pages on the governor's website and websites provided by our congressional delegation. One of the most important tools we have in the county is WorkSource Montgomery. They've been on the front lines of helping workers navigate these kinds of challenges, and they're ramping up efforts to meet this moment. And I've invited WorkSource Montgomery County's Executive Director, Anthony Featherstone, to talk more about the resources available and what they're seeing on the ground. So, Anthony, you can take it from here.
Thank you, Mr. County Executive. We really appreciate the opportunity to talk about the work that we do, especially for any of our 48,000 federal workers who live here in Montgomery County who may be affected by what's going on in the federal government. We want to make sure that you all know and the public knows how you can get help from your workforce agency here in the county. I'm going to talk a little bit today about the resources that we do have available to anyone who is impacted. And I'll start with our locations. And so you'll hear a lot of programs and services that are available, but if anyone does not know where to start, we have a comprehensive job center located at 11510 Georgia Avenue in Wheaton, another in the Upcounty Regional Services Center. You can walk into those centers anytime, Monday through Friday, 9 to 5, and ask for help, and we'll start from here if you want to talk to a live person in person. Because we know that there's an unemployment insurance attachment to this, we have worked closely with our partners at Department of Labor. So there's not only phone access to UI professionals, but we have actual people in our American Job Centers that can provide unemployment insurance assistance if you have any troubles with your unemployment insurance claim. We're doing a lot of workshops now. We're continuing to expand our workshops related to professional development, job searching, resume development. We do a lot of work in past times in trying to help job seekers prep to get into the federal government. We're going to still do some of that work, but now we're kind of reversing it. We're going to be doing a lot of work and offering workshops to help folks transition public to the private sector. We also, recognize that job searching in this whole process is stressful, and so we are will continue to offer new workshops related to the mental toll that job searching and this whole process takes on our residents and our job seekers. And so there's going to be a mix of professional development, how to job search, resume assistance, but also addressing the mental aspect with stress and anxiety that comes along with your job search. LinkedIn is a huge tool when it comes to job searching. So we're going to focus heavily on how to use LinkedIn to find your next opportunity. And your picture is critical. And so we are going to offer free headshots to folks who come to our LinkedIn workshops. And there'll be live headshots, and there'll be virtual or AI headshots, which is becoming a trend. So we want to make sure that folks have a professional headshot to add to their LinkedIn profile if they need it. But when it comes to finding employment, we want to make sure that everybody knows and is in the Maryland Workforce Exchange system. And that's the system that houses thousands of jobs and employers where you can post your resume, you can apply for opportunities, and you can obtain employment relevant to your skill set. And so we make sure that everybody has an updated resume in that system, knows how to access that system so they can find employers, and the employers in that system can also find you if you don't apply directly to that opportunity. For anyone who wants to brush up on any skills related to professional development or certification programs that don't come to our workshops, we have our Skill Up Montgomery platform. It is a virtual career training center that houses over 6,000 asynchronous trainings, and the Skill Up Montgomery platform can onboard every Montgomery County resident. So there's no limitation, and everyone can get on this platform and brush up on their professional skills, job searching skills, or if you want to grab a certification while you're in the transition process, you can study from the comfort of or convenience of your home or wherever you'd like to be without coming into a job center. For those who may need help finding what their next path may be, there's always walking into our brick and mortar centers and talking to a live person. But we have our career coach, virtual career coach program as well that's on our website. And I'll give you our website in a few moments, where you can do a very quick assessment and you can learn about the career opportunities that are available that are in alignment with your strengths, interests, values, and career themes. And so that's another system that's available to all Montgomery County residents that's not limited to a specific number, and you don't have to go into a center or meet with a staff member to utilize the virtual career coach function. We are also working on creating a task force with partners like Montgomery County Economic Development Corporation and other partners who you may come in contact with if you are affected as a federal worker or contractor, to make sure that there's a level of coordination when you are seeking services. And so there can be seamlessness as you try to access help or services to find your next opportunity. And so those are some of the things that we're doing. I think one thing that's coming is that we will upload a new landing page on our website, www.worksourcemontgomery.com. There'll be a new page loaded within the next 1 to 2 weeks that will house all of the resources that I spoke about locally and more, to include state resources and so forth. But we really want our residents to know that WorkSource Montgomery, your local workforce development board, is here for you. If you are impacted, we want to make sure that we do our part to make the process of finding your next opportunity as seamless as possible. So with that, Mr. County Executive, I appreciate the space. I will pause and hand it back to you.
Thank you.
Thank you. Thank you, Mr. Featherstone. Members of the media, we're going to open it up right now for questions regarding the impact of federal layoffs for the county executive and Mr. Featherstone. Brad Bell, did I see your hand up?
You did, but I'm off topic. I was going to ask.
Okay, all right.
So I'll wait.
Okay, cool. Let's take care of this topic first. Kate Ryan, WTOP.
Thank you very much. Yeah, you can hear me. Thank you. I wanted to check on the numbers that you flashed up earlier on, was that people who have been displaced from federal jobs? I just want to make sure I understand that data, and where would I find that? That was from the Labor Department?
I'd have to ask my staff where they culled them. It was NIH announced 1,500 workers. This stuff's not coming from the Labor Department. This is coming from what the federal announcements were: 1,500 from NIH, 5,200 probationary employees who lost jobs since the start of the month. And the numbers on the 4 companies in Maryland come from the Maryland State Department of Labor. If a large companies in Maryland, if they leave, they have to notify the state that they're moving and the number of jobs that are involved in it. So we get this as a matter of course. If somebody large leaves, they tell us who they are and how many jobs are lost.
Got it. And is there an area where I can find that link? Because there was one, and I thought it flashed up 808 on that.
Yeah,
labor.
that's the total number of jobs lost between these 4 companies. We can get back to you. I'll have Scott get back to you with what the link is to the Department of Labor.
Got you. But you're not saying that those 808 are directly related to what's going on in the federal government.
Oh, they are. These are contractors who worked with USAID.
Got it. Okay.
And so when USAID disappeared, not downsized for efficiency, but disappeared, these are the companies who no longer have contracts, will no longer get money from USAID.
Got it. I'll check in with your folks later. Thank you.
Thank you.
Thank you, Kate. Members of the media, any more questions for the county executive or, Brad Bell, regarding this topic? Go ahead, Brad, ABC 7.
I thought we were ready to move on to another topic.
Oh, no, not yet. Not yet.
No. Look, so we were just we're going through some of these contracts, actually, and, seeing women-owned business, minority-owned business. But I guess a lot of it is USAID related. I didn't know if there was targeting there. So it's not a question.
I'll give you an example of a contract.
Yep.
Rockville has this small business center, and they had this program for women-owned businesses, startups, trying to grow, and they lost $300,000. They were told that you can't have a grant for anything where gender or race is targeted. So you couldn't do a women's program. You couldn't do a program for Hispanics getting training, for the workforce. You can't do anything that targets people by gender or race. And if you spend, even if you didn't say it, and they look and see how you spend your money, they could decide based on how you spent your money that you were targeting, even if you didn't say you were targeting. This is kind of unprecedented, and it doesn't acknowledge any this is equally true for women as it is for, Black people in the United States. When you've been excluded from education opportunities, the ability to get an education, to get into colleges, which is extraordinarily different for Black people, I think the number, particularly when I was growing up, and the number of women who are so small in the sciences because they've been discouraged and often didn't find roles in the sciences. The idea that you have no responsibility to try to rectify the results of previous discrimination is just mind-boggling to me. It's
Thank you.
We'll reach out to the
fathom.
companies. But, yeah.
Okay.
Thank you. Members of the media, any more questions regarding the impact of the federal layoffs? No more questions on this topic? Mr. Featherstone, thank you for joining us this afternoon. I believe you need to depart. If that is the case, goodbye, and we'll see you soon. Have a great afternoon.
Thank you, Anthony. So yesterday I was down in Annapolis, and there was an important bill there. It's a bill aimed at protecting families with just cause eviction standards. So there are too many people who rent their homes and apartments are at risk of losing their place of residence without a valid reason. I'll remind people this is not something that those of us who own homes ever have to think about. The only reason you would lose your home is if you do not make your mortgage payment. That seems like a reasonable standard, but that is not true in the rental world. You can lose your home for lots of reasons. That's why yesterday I went to testify in Annapolis on behalf of new legislation that would require a landlord to have a just cause for eviction of a tenant. And since the moratorium on evictions was lifted following the pandemic, end of lease evictions have surged beyond levels we saw before 2020. Without just cause protections across Maryland, landlords can refuse to renew leases for no reason, leaving families scrambling with little notice. This kind of instability harms families, affecting jobs, education, and health, and pushes some towards homelessness. A just cause eviction standard would require landlords to provide a valid reason for ending a lease. It's a common sense measure already in place in other states. It doesn't stop landlords from managing their properties. It simply ensures that evictions are fair and justified. The legislation acknowledges all of the reasons a landlord will be able to carry out an eviction when the circumstances warrant it. This is focused on tenant actions that are damaging to the property, that disrupt other tenants from the quiet enjoyment of their living spaces. That means a tenant who insists on playing loud music at 3 o'clock in the morning, a tenant who doesn't control their children who might be running around in halls and defacing the walls of the building. And it also covers refusal to pay rent. What it goes after are cases where tenants get evicted for advocating for decent and safe living conditions in the buildings where they pay rent, and should have a reasonable expectation that landlords deliver reasonable and safe living conditions. A number of years ago, I think before 2000, I was a council member in Tacoma Park, and we saw a lot of what we would consider no-cause evictions. Well, actually, the cause was that tenants had called the county inspectors and said, we need you to come in here. We have rodents, we have, faucets that don't work, the landlord won't fix the toilets. And landlords would then retaliate and evict the tenants. Now, in the old days, which is when I first got involved in this, landlords would write letters, really nasty letters sometimes, and they tell the tenant that, I'm getting rid of you, you're causing me trouble, you're calling the housing department. So the state legislature actually passed a bill on retaliatory eviction and said you can't do a retaliatory eviction, which would be an eviction where if you because you called the housing department and they inspected the property, that now you're going to get evicted. That would be retaliatory. I think a lot of us thought that would address the problem. It did not address the problem. What landlords learned to do was not say anything nasty to the tenant. So if they were going to evict you, they just had to wait the 60 days before your lease was up and then tell you that you were not going to be able to stay in the apartment with no reason whatsoever. If they had given a reason, such as you called the housing inspector, that would be retaliatory. The tenant could go to landlord-tenant affairs and get the eviction squashed. So landlords basically learned to be more polite and quiet, but it didn't change their ability to evict tenants for the same reasons they were evicting them before. You know, as I was a school teacher, I think you all know that, and I taught elementary school, and, you know, you see when you're doing this, that family stability can help improve a child's ability to succeed in the classroom. When children are happy and not dealing with the kind of stress evictions can bring, hope grows and goals develop and accomplishments can be made. When kids are under stress of not knowing where they're going to live, um, when families are kind of in turmoil, when people are desperately trying to find new housing because the apartment they were living in they can no longer stay in, trying to find another affordable apartment, particularly for lower income families in the county, has always been a challenge. This all winds up affecting the children. And when kids are in that kind of situation, it's very hard to learn. And so it not only hurts people in the short term, but it hurts their children in the long term. I want to thank Delegate Janelle Wilkins and others fighting to make housing fair, stable, and affordable for all Marylanders, and I hope this legislation passes the House again and that it actually passes the Senate this time. We're going to end Black History Month next week by renaming the County Executive Office building after former County Executive Mike Legge. The ceremony will be held here in Rockville on Monday, starting at 3 p.m. We will have some special guests here to honor Ike, including Lieutenant Governor Runa Miller, Senators Chris Van Hollen and Angela Alsobrooks, as well as Congressman Glenn Ivey, and we're still waiting for others. Close to 300 people have RSVP'd to the event. We're prepared to handle a big crowd by providing an overflow room for the ceremony. For his part, Mike has been pretty humble about all this. He told my MC Media last week that he sees this as a testament to his entire team for the work they did to serve the county during his 12 years as county executive. We appreciate his humility, but recognize the leadership he provided created the impact that his work had on Montgomery County. He was the leader of what his team did, and it had a really deep impact on many things in the county. So before opening up to your questions, I'd like to give my health team and others an opportunity to share updates that they would like to provide, and then we'll come back to the questions from the media.
Thank you, Mr. County Executive. As folks have heard, or you probably know somebody these days who are sick, we have seen high rates of flu in the community. We marked a unfortunate milestone of our flu cases are higher than they have been in the last 15 years. And this year we have seen more flu hospitalizations and deaths than we've seen from COVID. Which this is the first time since COVID's been around that we've seen more flu than COVID. That has to do with several different factors, part of that being the flu shot is only partially a good match this year, but also because folks haven't gotten their flu shot in the numbers that we would like. It's not too late. We expect there to be a long tail on this flu season, so we do encourage people to still get the vaccine. It is available in many, many places. We encourage folks to do that. I do just want to highlight, as it is Black History Month, thinking about the health of Black Americans. We know that in Montgomery County, we have some of the highest health outcomes in the state and across the country, and that is still at the same time with disparities. And we do see disparities in our Black populations in terms of health outcomes and chronic disease, prevention, maternal health, and social determinants. And so we, as a county, remain committed to programming that addresses people in their cultural situation. We know that when we bring programs to people and engage the community, that we see better health outcomes. And so programs such as Babies Born Healthy and the SMILE program that address Black maternal health disparities, programs with our community health workers and with our mobile outreach team that go specifically into communities to meet them where they are very effective in helping to address health disparities. And so we continue to make sure that we are improving health for everyone. And you need to do that in a way that is targeted and relevant to the communities that are most highly impacted. I think the thing that we have learned from COVID is that you need to tailor messaging so that people can hear it and work with the communities that are around them, that they trust and go to. And so we as a department and as a county remain committed to addressing health in all pockets across the county. Thanks. I'll turn it to Dr. Ashford.
Thank you, Dr. Davis. No further updates from me. I'll turn it to Dr. Bridgers.
Thank you, Dr. Davis and Dr. Ashford. Just want to remind folks that we understand that there are challenges as a result of the federal executive orders that are being signed. However, there is help. The county continues to maintain a 24-hour, 7 days a week crises helpline. That number is 240 240-777-4000, 240-777-4000. Please reach out if necessary. And I'll turn it over to Sean O'Donnell now.
Nothing more to add from the reports. Thank you.
Well, thank you, everyone. Members of the media, we can open it for all sorts of questions right now. Jeannie Bixby, Moco 360. Go ahead, Jeannie. You are faster than Brad.
My question is quick. Thank you, Lorna. I just wanted to ask before the health team gets off. Dr. Davis or anyone on the team, do you have the exact, do you have the numbers for the rising flu rates, or could someone from your team send those to me?
See Mr. O'Donnell turning to get them. Yes, we can send those over.
Sorry.
We'll send what we have, Jenny.
Okay, thank you. I appreciate it.
Thank you, Ginny. Brad Bell, ABC7. Go ahead, Brad.
Sorry, after all the fake outs. Hey,
you're so patient.
well, you assume I am. I'm squirming out here. No, so listen, there's a hearing right now, joint hearing in Annapolis on the blueprint, right? Speaking of Annapolis, and I'm getting ready to go on in there. You know what's going on. What's your position on the governor's efforts to roll back some of these elements and save some money? It's significant. It's more significant to Prince George's, but there's a lot of money at stake for you guys as well. So what's your position on this rollback?
There's no way he can deal with his larger budget program without dealing with this. I mean, the choices are always when you've got a hole that's as big as the state's facing, that there's no one place you can land the damage. And so some of that damage is going to wind up pretty much everywhere. I mean, I'll give you an example. When I first got elected, second day in office, I got told, I was called into a meeting and said, oh, by the way, you don't have $40 million you thought you had, and that you're going to have to make cuts because that money was meant to carry the budget through July 1, and it was December 5th or 6th. And I was told, you have to make cuts. I had to make cuts. I had to cut things that I did not want to cut, but you don't have any choice. When the money's not there, the money's not there. I like his approach of trying to focus on the most meaningful things. I'm a big believer in doing that. I think if there's not enough money to do the whole thing, it would be important to make sure that what you do focuses on what you think are the most important services you can develop and provide to the kids we're trying to help. And I have opinions about that, but I think it's a necessary thing to do. There's no way he was going to be able to fund that without even doing more damage to the budget in other areas. So this is not something where you can just move the deck chairs and everything will be fine. You just have a different seat. He's doing what I think he had to do.
Think there'll be an impact on the kids, I guess, particularly the Title I schools?
Our budget from the school system, we weren't looking at a lot of money this year. We expected it more to be next year. But some school systems are in different places because Montgomery County had gotten ahead of some of these things. We didn't have the bills coming in that school systems, for example, I won't say for example, but school systems that had not done as much as Montgomery County had done, they got faced with a higher burden ramping up. But we still have a burden. We had things last year. We're going to have things next year. But I know no way of avoiding this. And we're dealing with our own issues of shifting budget items in the state. I'd be happy to go down to the state and say, don't put any more burden on us, but the burden's going to go somewhere.
Thank you. Thank you all for your patience.
Thank you, Brad. Kate Ryan, WTOP.
Thank you, and I appreciate it. For the health team, I did want to ask, in terms of being able to track everything from flu to bird flu, is the CDC data as full as it needs to be? Are you saying, we had that, they took some things off, then they restored, but I heard that, and we reported on one aspect of the morbidity report had been missing. Information that was expected had been missing. Where do things stand now? And do you feel that when people go to the CDC site, are they going to get the information they're looking for from your end?
Well, that's a great question. Thanks, Kate. We actually were talking with our epidemiologist this morning about that. And many of the sites have been restored. Our epidemiologist team has worked with other local epidemiologists. I think the benefit of being in an area that has so many health researchers is that there is a nice epi community, and many of them have found workarounds. There are some foundations and other research institutions that have archived some of those sites and have been able to access it. So in terms of the work that we are doing on a day-to-day basis, we are still able to access most of the information that we need. A lot of that comes from state and what our own epidemiologists are able to pull. I will say, it is a little bit more challenging because sometimes we have to go to other sources. So we are resourceful in that we are able to find the information that we need and get it ourselves, but it is not as easy as it was previously.
Got you. Either one of the other health officials here with us? We're good?
I don't have anything else to add.
I think Dr. Davis covered it all, Kate.
Gotcha. And just on the influenza, the seasonal flu vaccination rates, again, Mr. O'Donnell, you were talking to me last week, and again, you were saying those were down. Do we know why?
Well, they are certainly lower than the vaccination rates we had during COVID, and when people were very aware of the threat and making it a priority. Also, during COVID, people had they had less obstacles sometimes to getting a vaccination. Public health and the healthcare infrastructure made it very easy to get a vaccination. Now people have to go and use their insurance, and the insurance will work at some places but not others. And so I think people might get a little frustrated trying to find a place to get a shot. Almost every insurance will cover the flu shot and cover the COVID shot. So please, if you're having trouble figuring out where to do it, call your insurance company and just ask, where can I go to get that free shot? And if you need help, try calling us at the health department and we can help connect you. If you don't have insurance, we'll also help you get a shot as well.
Gotcha. Thank you very much. I appreciate it.
Thank you, Kate. Members of the media, any more questions for the county executive and or the health officials this afternoon? No more questions? Going once? Twice? Well, thank you everybody for joining us. Stay safe. Have a great afternoon, and we'll see you next time.
Thank you.